I would like to welcome our next speaker, Professor Dr. Simcha Jong Chin from Paris Polytech Institute of Interdisciplinarity and Innovation.
From Miriam to talk a little bit and provide some reflections about sort of creating ecosystems around fair implementation, the fair infrastructure, and in particular where it comes to involving industry, which I think potentially has a very important role to play. So what I'll do during my 10 minutes is I'll talk a little bit about how, this fair infrastructure and this proof of concept, this pilot study, where we learned a lot about today, is really, it seems to be providing sort of a prospect of us being able to reach this holy grail of creating these so-called learning health systems. In order to achieve this, we need to create, to realize this potential value of these infrastructures, we need to create ecosystems, mobilize users, and I'll talk a little bit about sort of the challenges of creating ecosystem design, mobilizing internal users within health facilities, and also which can be quite challenging, and also the potential role industry can play in terms of co-creating value and creating greater incentives for all, for different user groups to become involved. So first, a little bit about sort of this, what I mentioned, this holy grail of creating this learning health system, and why that's such an important such a valuable objective. And in order to understand better, it's good to reflect a little bit about how we organize our current medical knowledge production system is organized. So while more and more, like large parts of our lives, how we watch television, we order our food, we do our shopping, all of these activities in our daily lives, they're governed by, more and more governed by algorithms that are continuously updated with live data. And the healthcare domain is really lagging behind in that respect. So medical practice still very much anchored in producing knowledge through sort of these narrow clinical studies that in many ways avoid real world complexities. Clinical trials often detached from local contexts, tend to exclude complicated cases with multiple ailments, complex treatments. And these trials that advance knowledge, they're very expensive and they really take a very long time to complete. So that's why there is so much value in this promise of the so-called learning health system. So what do we mean by a learning health system? So basically in our healthcare system, data is generated every day for different practical purposes. And all this data is really potentially a valuable source of knowledge to fuel learning health systems, like our behavior on Amazon is for shopping behavior, and yes, other trivial activities, but also in health, this is a lot of potential value. But currently these data are largely wasted and locked into data silos. So the advances in medical research methods pertinent to big data has there's been some of this sort of analytics going on, but mostly confined to sort of more research context, and such as bioinformatics. And fair health information systems, they are really provide an opening to create a health system that's able to deliver on this. But in order to to create value, so the value of any platform, so we're more and more moving towards a platform economy. But as I teach my students, the value of platforms, it increases the more user groups you involve in these platforms and sort of co-create value for other groups on these platforms. So we have here two critical groups that we need to mobilize to join this the ecosystem. So you have these internal user groups. We talked about sort of the sort of the pilot studies focusing on infectious diseases, particularly COVID-19. But what you want is to increase the value of the platform to you want to involve different specialty groups within hospital organizations. So you want oncology, cardiology, all these specialties you want to get involved. Also, there are we talked during the afternoon a little bit about how this is fair. It's also valuable to the finance people within hospitals, hospital administrators. So you want to all get them involved. And of course, let's not forget the patients, which have which also generate a lot of data. And you want to evolve in a platform like this through they generate data through through their interactions with the health system, electronic devices, etc., etc. So the in the project, so it's a very smart approach to incorporate, stick to established ways of collecting data and not to change workflow. But what we know from the research on digital transformations is really that, so you have, once you start to expand the different user groups within the hospital, they all have their own ways of using information, collecting data, and those data become valuable if you start to integrate things across different user groups. So inevitably, that's something very challenging to do, and at some point, there will be challenges about changing existing ways of doing work within the organization, and sort of this process of digitalization, organizational digital transformation, where everything it's about we're creating these sort of integrated data sets where you're able to that you can use as the basis of this sort of learning. That's not an easy thing to do, and it requires a lot of resources from these different groups. So as I mentioned, the value of platforms very much tied in terms of how many user groups you're able to mobilize, and the persistence of data silos within healthcare organizations, across user groups, electronic health record systems, disease registries, claims data, etc., are really a key barrier to these digital transformations. So FAIR offers a number of major advantages that have been elaborated on already, to basically sort of create this common a shared platform for all these different groups to together co-create value. But in order to but where we but nevertheless, this is a very costly process, requiring a lot of organizational resources. And where firms come in is that where you're able to, the key challenge is to involve firms in terms of where they have a lot of expertise is sort of transforming, sort of creating through this these groups sharing their data, and in exchange then to help you create more tangible benefits for the users that are sharing data. So these data have a lot of potential in terms of creating new decision support systems, sort of diagnostics in diagnostic support, optimizing clinical care trajectories, cost optimization, and industry has a lot of expertise and resources to provide these solutions, creating sort of incentives for these, sort of creating sort of direct benefits of these different groups within the hospital health facilities to contribute and become a part of these ecosystems. So so industry, so there are a number of ways, sort of this number of areas where industry can of course add a lot in terms of co-creating value from these data. Pharmaceuticals sort of these data can be very valuable in supporting post-approval, clinical stage, stage 4 studies, really tracking in practice how, sort of in real life how medications work. So this kind of very infrastructure will be able to track that. Produce manufacturers of diagnostics equipment. They're already sort of a lot of those diagnostics machines are connected to the cloud, but sort of becoming part of this fair infrastructure, it really creates the opportunity to analyze the effectiveness of these diagnostic services in the broader context of care trajectories. Same for medical equipment manufacturers. And so the challenge is how to get these firms involved in these ecosystems. So as we know, sort of digitalization, it's it's really disruptive. It's a disruptive process in terms of changing the value propositions that firms they need to deliver. So we're all familiar with sort of car and how digital. So as parts of our society become dominated by platforms and are digitalized, sort of value propositions, they are really fundamentally shifting. So an example of the car industry, where sort of value drivers of value creation, so sort of about quality. Style. When you buy a car, it's about style, comfort, right quality, cost, or brand. If you're looking at sort of car transportation and sort of leading platforms in this area right now, the value drivers are very, very different. So what we've seen areas that have started to digitalize, where platforms have started to become important in biomedical devices. We've seen a similar shift where 20 years ago, biomedical devices, medical device companies, it was mostly about making equipment. More and more, it's about customization, performance, monitoring, patient involvement. So from being hardware companies, these are more and more service/software companies. So a very big shift in sort of value creation drivers. The introduction of FAIR is changing this again, and I'll talk a little bit about that. Sort of the way you design your platform, it has really fundamental implications for the way firms so for the kind of firms that kind of activities firms do to extract value. So sort of platforms, in designing a platform, you have to decide what kind of restrictions do you put on different user groups. An example we're all familiar with is sort of the operating system platform. You have sort of the closed operating systems, Windows, Macintosh, the iPhone, iOS. You have the completely open system. And if you look at the sort of the companies, the type of companies that are able to capture value across these different platforms, very different types of platforms. So on one hand, you have these very closed platforms, sort of Mac OS and Windows, where most of the value is captured by firms such as Apple and Microsoft. In sort of the Linux open sort of platform, it's much more about value creation. It's more about providing services, implementing Linux in particular settings. So you have very different types of companies that are sort of the leading companies in those spaces, like Red Hat, IBM, and Oracle. And so also here we have, I think it's interesting to start to reflect about what verification means for value creation dynamics for industry, and how it changes the role of industry in biomedical innovation system. Where it's of course it's something that's still very open, but where the value firms are able to create, it's to sort of more at the level of system level decision support services, real-time clinical cost optimization, and providing the kind of decision support systems so industry is able to provide, but that are much more difficult to, so that are quite sophisticated and where you really need industry support to realize that. So in conclusion, self-delivery infrastructures is really key to provides a interesting key to realizing sort of this ideal of creating a learning health system. Verification is a process really of organizational transformation, and verification really represents a disruptive challenge for business as well, while at the same time opening up many opportunities for value co-creation. And so I think it's really interesting to see some first use cases that try to sort of incorporate industry use industry expertise to create these decision support systems. So that was my presentation.
Thank you so much. And